Now, clean water is something most of us take for granted, but its shortage in urban areas can and is having a direct effect on healthcare. It is something the Wish Healthy Dry Cities report has been investigating in a call to action that reaches from clinical concerns to urban planning and architecture.
Hello and welcome to this session on Healthy Dry Cities, Health in Dry Cities. Welcome, I'm the moderator Kirsty Wark, and we're pleased to have you wherever you are in the world. And today's event means that you can join us, whether you're in Iceland or Qatar, Aberdeen or Christchurch, you are very, very welcome. This is a critical session, the foundation of which is the Forum report, two of whose authors are on the panel. The world is indeed at a crossroads. The key issues, climate change, continuing urbanization, persistent public health challenges, and gaping inequalities in health and wealth around the world. Water scarcity threatens public health. We have the evidence. This session is about the action that we're actually prepared to take for healthy dry cities. And the report contains detailed recommendations, which I urge you all to read to help water-stressed nations. I hope as many of you as possible during the course of this session will join us with your own questions, which I hope will be stimulated by the conversation I'm going to have with the panel. As many of you can take part as possible, we'll try and get all your questions in. Let me introduce the panel. Professor Howard Frumpkin is a physician and epidemiologist, Professor Emeritus of Environmental and Occupational Sciences at the University of Washington. His research interests include the health aspects of the built environment, climate change, energy policy, nature contact, and sustainability. His list of academic affiliations are testament to his passion for the global environment. Dr. Maitre Borde-Das is practice manager in the Urban Resilience and Land Global Practice of the World Bank. Based in Washington, D.C., she was previously the bank's first global leader on social inclusion and has led several research and policy initiatives, most recently on inclusion matters in Africa. His Excellency, Mr. Abdullah bin Abdulaziz bin Turki Asasgray, is Minister of Municipality and Environment in Qatar, a position he's held for 2 years. He's also Managing Director and CEO of the Qatar Railways Company. He has a long-standing expertise in delivery of electricity and water through project management of the Qatar General Electricity and Water Corporation 1996 to 2008. We're also joined by Dr. Ahmed Al-Madari. He's the Regional WHO Director for the Eastern Mediterranean, WHO Director for the Eastern Mediterranean, a specialist in family and community medicine, and a senior consultant in family medicine and public health in Oman since 2009. He was involved in the development and modernization of Oman's health system, particularly in areas such as patient safety. And last but not least, the Mayor of Tirana, Mr. Erion Velajaz, re-elected for a second term in June last year, And prior to being mayor, he was a member of parliament and minister for social welfare and youth. He has worked for several international humanitarian organizations in the Americas, in Eastern Africa, and also in Kosovo. So welcome to you all. And prior to our discussion, here's a short film outlining the key findings in the Forum report.
Hello, this is Howard Frumkin, Emeritus Professor of Environmental and Occupational Health Sciences at the University of Washington, speaking to you from Seattle. It's been my honor to join Dr. Maitreyi Das in co-chairing this collection of articles for the British Medical Journal and for WISH on healthy dry cities.
Thank you. And my name is Maitreyi Das. I'm practice manager for urban resilience and land at the World Bank, speaking to you from Washington, D.C., and a great pleasure to be here for this panel. All right, today we're going to speak to you about our volume, which is on healthy dry cities. A healthy dry city is one that manages its physical as well as its social environment in the face of water scarcity so as to optimize the health and well-being of all of its residents. We know that water scarcity is a very pressing global issue. This map shows you the countries that tend to be water scarce, but within those countries are cities. And these cities can run the entire gamut from those that have an abundance of water to those that are located in very water scarce areas or in areas that are facing droughts. What it means is that both water resources as well as health, as well as urban development have to be co-managed. They have to be managed in a synchronous way so that cities and countries moved towards healthy and dry cities, that move towards healthy cities in the context of water scarcity. What happens in a healthy dry city? The context is underpinned by various factors. One of those factors, of course, is increasing urbanization, which we are seeing across the globe. We are also seeing a huge push that comes from the risk of climate change. Another context we're seeing are environmental problems, which we're seeing increasingly affecting both the health of cities as well as the context of urbanization. All of these lead to a double burden of health in cities. Underpinned by all of this is rising inequality, never more relevant than today as we face a surging pandemic.
And all of these circumstances introduce a range of health hazards in dry cities. In fact, these hazards cover the entire spectrum of causes of human suffering, illness, and premature death. Infectious diseases. For example, it's very hard to maintain good hygienic conditions in the absence of plentiful clean water. Non-communicable diseases. For example, it's difficult to maintain a physically active lifestyle in an environment that is extremely hot. Mental health, because of the stress for many people of finding enough water and of dealing with heat. Even interpersonal violence, which we know rises in hot conditions. On this next slide, you'll see a list of the conditions that cities need to maintain to keep people healthy. This is true both of dry cities and of cities where water is plentiful. And in both cases, the conditions are fairly straightforward. There's little mystery here. Clean air, clean water, plenty of access to green space, access to opportunities for routine physical activity, access to healthy, affordable food, and so on. But some of these conditions are especially challenging to provide in the context of dry cities. Air quality, for example, because dry cities are often very dusty places, and so on. Now, addressing these challenges is a multi-sectoral and multifaceted challenge. As you can see on this last slide, each of those conditions needs to be delivered by a variety of strategies, tactics, and actors. Across the bottom of the slide, you'll see that the health sector has particular responsibilities. Governance matters a lot, and in particular, coordination across all sectors of urban government and across all levels of government from national to local. Technical solutions are very important, ranging from desalination and stormwater harvesting and gray water reuse, all the way to nature-based solutions. Behavior change is important, and that requires appropriate social marketing. In our collection, we've delivered a set of recommendations related to these activities to help policymakers and members of the public address the challenges of keeping dry and hot cities healthy.
We very much look forward to having you with us in this panel and look forward to participating in this really important summit. Thank you.
Thank you.
And thank both of you too for the report, which, you know, as a layperson, it was so interesting to read, because as a layperson, you could still understand so many of the issues because they are faced day and daily by so many people. And I wanted to bring in with you, Dr. Ahmed Al-Mandari, because the Eastern Mediterranean is home to many of the world's water-stressed countries. And I wonder if you can highlight innovative examples of practice in protecting health in these areas, because of course no two countries are the same, but we can all learn in one measure or another from each other.
Thank you very much, Christy, for your question. And before I start, I'd like just to express my sincere thanks and gratitude for the organizing committee to invite me to talk and share, ideas and thoughts on this important issue. And I'm really very pleased, to see the report produced by Howard and also DAS, on a global issue. But as you said, here in IMRO, we are seeing a real challenge. Because of many reasons, but one of them is, as you all know, 2/3 of our countries are really undergoing either acute or chronic protracted emergencies and instabilities, which definitely have affected, the infrastructure of communities, including availability of clean and safe water, as well as, sanitary services. We have been working with colleagues at country, regional, and global level in order to make sure that whatever sort of initiatives we bring to the countries will definitely serve the purpose in terms of making sure that safe water is really available, accessible to all communities and individuals, as well as making sure that whatever sanitary services are there available. Yes, we have done a lot in spite of the challenges. And in fact, one of the initiatives that have been started in the 1990s by IMRO is something called Healthy Cities Project or program. It started in Iran, but then it got adopted and adapted by many countries here in the region. So far, in fact, we have managed to have 15 countries in the region adopting and adapting this program, with around 92 cities in IMRO. This year, we managed to get 10 cities from different countries, and more is coming on the way to make sure that, yes, we have healthy cities. Now, in this healthy city program, it is composed of around 80 indicators in 9 domains, in fact. And these indicators will tell us whether that city is really qualified to be labeled as healthy city. And it includes a wide range of themes and subjects, or I may call it domains. One of them is something called environmental health, which includes water, sanitation, food safety, and air pollution. And we have our own experts, at WHO, with its 3 levels involved in reviewing and updating these sort of guidelines and standards. And in that program, in fact, part of the program is to make sure that people in these healthy cities are having, as I said, access to water and sanitation services. In addition to that, healthy cities, we have something called healthy villages. It is almost carrying the same concept with the same content of guidelines and protocols, but it is more focusing on villages. And so far, we have 29 villages here in the region. More is coming. Another third initiative have started, in fact, some time ago, which is called age-friendly cities. And as we all know, when it comes into elderly people, they have their own specific needs, especially when it comes into getting access, easy access to water and sanitation services. And we have criteria and standards. The departments at the regional are working on that. So I'm sorry if I took this much time. Back to you.
No, I just want to ask you a very quick follow-up, because presumably the WHO is capturing all the data, because it seems to me you've got all these indicators, you've now extended it to healthy villages. And is there a kind of best practice manual, as it were?
Exactly. In fact, based on information collected at a ground level, the experts or the department at a regional level have come together. They have had several meetings in which they'll say, now, yes, we have these sort of standards have been implemented, but still we need to develop them. So they produce a guidance to all countries in which, if they wanted to go for this healthy city sort of project, they have to follow certain criteria. Once they are ready, we deploy a team of experts to go to each individual city with evaluation, and then they come back with a report to be labeled as a healthy city. And then another evaluation after some time to make sure that they are still adhering to whatever standards.
And there is like a kite mark. You get an accreditation, which is, of course, very important.
Exactly, and it is given in a celebration at a country level, in fact, a national level.
Your Excellency, I wonder for Qatar, there are a lot of challenges in climate, but what are some of the initiatives? I mean, even down to the basics, I was thinking, having been there, in any dry city, aircon itself is a great user of electricity. I wonder what some of the initiatives have been that you have seen in Qatar. I think you just have to, that's it.
Yeah, thank you, Christy. And a very interesting question. Before I answer, I would like to thank you and thank the organizing committee to invite me to be here on this very important topic. It gives me an opportunity to shed some lights on what we are doing in Qatar in respect to the climate change initiatives. Recently, the climate change has become one of the top priorities for the state of Qatar, if it is not the number one. And this is resembled and represented on the Qatar National Vision 2030, and also with the development Qatar National Development Plans. Also, it has a lot of initiatives in reference to the climate change. Recently, the Ministerial Council has formed a national climate change committee chaired by the Ministry of the Municipality and Environment, and participated also by other members from other agencies. There are many examples of initiatives. I will give you just a glimpse of these examples. I will not share all of them, but these either has been pursued or is being pursued right now in different sectors. For example, in the energy sector, we have the Al Shaheen project. This is a very large scale project to sequester 5 million tons of CO2 by 2025. And also we are having on that project for the expansion of the new LNG trains to reduce the energy by 25% compared to the current world standard. Not only that, we are also entering in the renewable energy. Also, we have the largest scale solar power plant, which is almost 800 megawatt of power to be generated to the national grid, and this is to be operating by 2022. This is almost 10% of the current demand. On the energy and water conservation, we have made good achievement to preserve 17% and 18% respectively on annual basis on that aspect, which it has a very positive impact to the emissions. In the transport sector, we have launched a world state-of-the-art metro system, and thus the aim of the public transport system is being upgraded now to have a share, this mode of transport to have a share of 20% by 2030 compared to the last year of less than 1%. So thus it will also encourage people to move from the private transportation to the public transportation. On the electric vehicle also, we are planning to have 25% of our public buses to be electrified, and by 2030 it will become 100%. And that's really from the transport perspective. From water perspective and waste management, the recycled water, now we are utilizing around 100% of our recycled water on the irrigation and industrial uses. And also we are planning to save a lot of usage of the groundwater for the cultivating the fodder here in Qatar by using the recycled water. And that it will save 125 million cubic meter of water annually, almost 50% of the groundwater utilization. So that's, and also from the waste recycle and the solid waste, we are having the waste to energy, which treat 2,500 of waste, and also to convert it to the power to energy, which generate around 50 megawatt. There are many initiatives, as you probably, as I have shown you, and also we are compiling an action plan for this decade up to 2030. So to integrate all the efforts by different sectors, even including the building, the energy efficiency in the building. So we are also improving our building materials, building codes, building standards, to have a green building, and thus to minimize or to preserve and to conserve the energy and water utilization. That's at the local domain. Internationally, also Qatar is committed. His Highness Sheikh Tamim, the Emir of Qatar, he's pledged last year $100 million for the least developed country and islands to combat and to mitigate climate change impacts. So we are present locally, we are present internationally, and we are geared to move forward and to implement a lot of initiatives which will be positive for our planet.
Great. I just want to come back now because I know that Erion Veliaj, the Mayor of Tirana, you've had particular problems, like many cities, with an aging water supply. And I wonder how you've improved the management system, consumption, and also education about it.
No, thank you so much. It's a great pleasure to be in the panel. I remember 5 years ago, we had a major drought. I was just elected mayor. I got sworn in August, which is the midst of Mediterranean heat, and huge swaths of the city were without water. What happened is, this was a city decided as a capital about 100 years ago. It was only 10,000 people, and in 100 years it grew 100 times. It became over 1 million. So while most urban planners during communism and during the rough transition years after the fall of communism were mostly obsessed about housing and treating the city as a dormitory, they somehow failed to think about water and sanitation. And I know going from communism to democracy was very important, but as Mahatma Gandhi used to say, sometimes sanitation is more important than independence. And I don't want to play politics with it, but I'm just saying is that you can have all the political gains in the world, but once you live a very undignified life, it really amounts to nothing for the average Joe, that is. So we started by not fixing water infrastructure first. As a young mayor of 5 years, I always believe that the most difficult infrastructure project to fix is only 10 centimeters long. It's from here to here, because this is where our value system resides. This is where our mentality, how we treat public space and public goods, including water as an asset. So we have to start with some very, very basic notions, like first, you don't steal water. You don't puncture a pipe and start watering your cornfield or wash your Fendi Mercedes. No one in France washes their Mercedes with an Evian water source. So we got to get that straight, and we started first by trying to fix a lot of the urban legends that we had developed around water as an endless resource. Second, everybody pays. No one is willing to finance a utility company, no serious bank, if they find out that most of your clients are not paying based on their political affiliation. So one mayor would be in and all the left-wingers don't pay, and another mayor comes in and all his right-wing buddies don't pay. Everybody pays. It's merchandise. It's a good. If you don't leave your restaurant without paying, if you don't leave your shop without paying for goods, then you should not turn off your tap without paying for water. So not only we made it obligatory, people, no one wants to pay for anything. Who wants to pay taxes? But people don't mind paying if everybody pays. And second, they don't mind paying if they can see results for what they pay. So we started with some very, what we call the low-hanging fruit, by basically investing in multiplying our filtering resources, in adding the pipes that bring water from the major reservoirs and the water sources of the city. And the pity is that Albania, it sounds like a dry place because it's in this panel and it's by the Mediterranean, but statistically, it's second after Norway when it comes to water sources per capita. So it's clearly an issue of these 10 centimeters that make up for the missing mile-long pipelines and investment in reservoirs. So once we went from collection of 17% to now of 98.7%, not only do we collect all water bills, but we also make sure that a lot of the city taxes are in the water bill. So it has increased our overall financial performance, got the EBRD to finance first multiplying our filtration systems and a lot of the direct lines that replace a lot of the punctured lines. And now we are in the process of going in some of these new neighborhoods that have been added in the last 30 years and multiplied the size of the city. And now we're doing the capillary network. So now we have a digital system, an app, in which people can report if someone is abusing with water, if someone is puncturing the line, if someone is not paying, if someone is watering their cornfields. And it's amazing that instead of having 100 inspectors from the water utility company, we pretty much have 1 million people who are reporting daily and sort of helping us self-police a system that otherwise was out of control. Now, we went from an average of 3 hours a day. After 2 years, we went to 7 hours a day. Now we have 70% of the city, 24 hours a day, and the rest of the 30% between 18 and 20 hours a day. So it is doable, it can work, but you need some political will and you need to be, I think, politically independent when you make these decisions. And if you treat everyone equally and everybody contributes a little bit without discrimination, and you immediately show results, then I think, like in our case, banks are waiting in our door who comes in first. We're working with EBRD and KfW and JICA now that our books are in order. Our challenge is how do we go to the next level? Yeah. Property prices in any capital, but including Tirana in modest Albania, are going in the downtown area 3,000, 4,000, 5,000 euros a square meter. So the question is, if we want to do solar panels in a city, in a country where 99% of our energy is hydropower, then the best real estate to use is our water reservoirs. So we're about to open a bid in which we use the same reservoir not only to supply the city with water, but also use its surface with floating solar panels to be one of the leading, if not the only, city in this part of Europe where we get 100% of water and energy from the same water source.
So what I was going to ask you was, in the course of doing all this and over a very fast period, in the last, say, 10 years, how, and I was going to ask this of Your Excellency as well later on, in terms of educating the next generation, do children in Tirana now understand about the importance of water? I know that obviously they'll be taught about wider climate change, but do they understand now how valuable water is?
I believe children are an immense source of public advocacy, and sometimes we forget that. As politicians, we're constantly pressured, including by media, to always think of taxpayers and voters, right? It sounds fairly legitimate. Well, it is not, because it somehow forsakes everyone 18 under. Yeah. They don't vote, they don't pay taxes, but they're also residents in the city. And I think if we're only obsessed about the next election, we'll lose the next generation. So we have actually, as a matter of fact, and I know it sounds shocking, but we have more people working in kindergartens and schools about water conservation, about mobility and bike lanes, and mandatory courses in every kindergarten how to ride a bike, and about eating healthy, forgetting chips and carbonated drinks. So our army of educators is actually larger than our hydraulics department for the water utility. And so again, fixing this infrastructure right here in between our ears is sometimes more important than the water pipelines.
Dr. Maitre Bordia-Das, I mean, fascinating to learn in Tirana and in Albania that kids in kindergarten have to learn to ride a bike. I think that is absolutely amazing. But throughout your time at the World Bank, you've looked at the issues of equity and inclusion in different areas. And something like that is not expensive. Teaching every kid to ride a bike, teaching every kid about the importance of water retention, about good behavior and so forth. How do you get policymakers to continue these issues in terms of protecting health in water scarce areas? Because of course, all the things that we've just heard about add to personal health.
Thank you so much, and that was absolutely brilliant, Mr. Mayor. That really gave a lot of energy to the conversation and direction as to what we could potentially do. As far as policymakers is concerned, so I always recommend that they start with an acknowledgement of the issue. I mean, the acknowledgement of the issue is not just the fact that, oh, there's scarcity of water, but the fact that some people have more, some people have less. Some people are healthier, others are not. Some people can, in a dusty environment, some people can afford to have air purifiers and air conditioners, and others cannot. So this whole issue about health for whom and water for whom, I think, becomes extremely relevant. And one of the things that we advocate for in our volume is the fact of really recognizing the issue. And it's not as simple as that, really. It's about the way you do the assessments. You can have a lot of data and not know what to do with it. You can have a lot of analysis and not know what to do with it. So I think that the first step is to have the data, to be able to have the analysis, to be able to understand what are the axes of exclusion by which certain groups tend to get left out and other groups tend to be in. And it's not just about poverty. That's the other thing, is that people tend to obsess and focus about poverty, which of course is essential, but it is necessary but not sufficient to focus on poverty. So that's one area that we try and steer people towards, steer maybe policymakers if we have their ear. A second thing is that, what do you do once you have that analysis? What do you do? How do you make sure that you are targeting the people that are most in need? And that's something that's hard to do, because very often taxes, subsidies tend to be regressive, and they tend to actually penalize the people that they're supposed to be protecting. And so do we have a good understanding of the ways in which policy has both intended consequences, but also unintended consequences? And that takes me back to that same idea of what are we analyzing and where are we actually intervening? And targeting becomes really important, especially within city level, because a lot of people really get left out of even the targeting. But so, for instance, if you have undocumented migrants who are in the city, the chances are that they're going to be invisible, but they are residents of the city. And what are you going to do about them? So I think that some of those issues about targeting become extremely important. And it's not just whom you're targeting, it's how you're targeting. So how are you actually making the difference towards a healthy city in the context of dryness? So not just whom you're targeting. And let me give you an example from the cultural competency movement, where essentially what people are saying is that minorities or people that speak a different language or people who have a different culture, minority ethnic groups, for instance, um, tend not to go to health centers or may actually reject the services that they are being provided because of the manner in which they are being provided, or because of the potential humiliation, the fear, the manner in which they are treated by doctors, by nurses. And so, what the cultural competency movement is basically saying is that you hold medical providers, health providers, water service agents, hold them accountable, not just for their technical expertise, not just for taking blood pressure right and recording it, but also for their cultural competencies. So to be able to bring people into the fold and to create a trust in the system such that you're able to reach not just the people that speak the language that everyone else speaks, but people, for instance, that may be deaf or may be blind or may speak a minority language that you're unable to reach. So that's a second point. And a third and kind of final point is this issue of accountability and transparency. So yes, and now in the days of COVID-19, there is a lot of creativity around data collection. There's a lot of creativity around monitoring. And this monitoring now has become monitoring through, say, real-time high-frequency survey data that is being collected by mobile phones or that's being collected online. What do we do with this? This is a huge amount of data. And so I go back to my original point of not just the ex-ante analysis, the ex-ante collection of data, but this ongoing monitoring that you're doing. What do you do with that? Now, you could either just do monitoring and do kind of a fairly numerical, mechanistic exercise, or you could put the data up on the web for people to actually see. You could actually put it up and disclose it. You could disclose it to young kids. You could disclose it within neighborhoods so that people understand what's going on in their areas, and the opaqueness then disappears and people take their own initiatives to make the changes. So exactly the kinds of initiatives that our previous panelists have spoken about, how do those come about? How do you empower people to actually, and I don't like the term empowerment because it's just very top down and very supercilious, but how do you do that? So I think that transparency, accountability, creating an enabling environment such that, for instance, right now there are wildfires raging in Brazil, and indigenous populations actually in the Amazon have long-standing experience in dealing with wildfires. How do you take some of that knowledge and actually bring that into the mainstream and allow people the space and the ability to actually run a real democratic, real participatory governance mechanism? So I'll stop there.
And it is an issue whether you're a low, middle income, or high income country. Everybody has the same problem, but they're just faced with fewer resources to deal with it. And I wonder, Howard, coming on to you, I mean, if climate change is one of the key themes of this year's conference, how do you make sure that there's a more equitable delivery, but also equitable basis of understanding? So, where are the big academic papers? Where are the practices and so forth? And how are these disseminated among lower income countries and higher income countries?
Well, Kirsty, thanks very much. And let me begin just by echoing what my fellow panelists have said. What a privilege and an honor it is to be part of this panel and to have contributed to this BMJ series and to this section of WISH. Climate change, as you mentioned, is of course one of the biggest contextual issues that informs all of our thinking about healthy dry cities. In fact, about every aspect of health, environment, and development. Climate change undergirds the supply of water. And it's a supply issue because dry parts of the world are becoming drier. In fact, that's happening faster than many of the forecasts predicted. It's reduced rainfall and also reduced flow of water in rivers, reduced melt from glacial sources for places that depend on glacial snow melt. So dry places are becoming drier, and the supply of water in many cities is diminishing, meaning we have more and more dry cities. The demand side is also relevant. Cities are growing, and that means that in cities, more people need to have access to water. And that's not unrelated to climate, because when a region becomes dry and agriculture suffers in the region, you see an enhanced migration from rural areas to urban areas, driving demand for water even more. That migration also tends to bring about some of the inequities that we were just talking about and that you mentioned, Kirsty, because people who are migrating from rural areas to urban areas are often disadvantaged, and they bring with them health burdens that come from rural areas, health burdens that are often compounded by the challenges of setting up new lives in urban areas. So we've got supply, we've got demand, and lastly, and perhaps most interestingly, we have a lot of complexity in tackling the challenges of healthy dry cities because of climate change. This exemplifies the first law of ecology, that everything is connected to everything. So consider, for example, that desalination is one of the important technical strategies for providing clean, potable water to people, especially in coastal cities that are dry. But desalination is very energy intensive, meaning that if we use fossil fuels to desalinate, we are contributing to the burden of carbon emissions and to climate change. Or consider that vegetation, tree canopy and other vegetation are important strategies for reducing the urban heat island effect. But if you want to have vegetation in your city, you need water to supply it. So there are unintended consequences, feedback loops, complexity in tackling the challenges of healthy dry cities that climate change brings about. But, decreased supply, increased demand, a lot of complexity in how we handle these issues.
But many of these dry cities are also resource constrained, and I wonder if there are inexpensive solutions to use in these environments. I mean, because not everybody can pay for big infrastructure plans to change things. I mean, what about inexpensive solutions, Howard?
Well, I think some of the least expensive solutions are some of the most important. And I'll go back to one of the things the mayor said, the 10 centimeters of infrastructure right here. The social marketing, the education of children, the raising of awareness of people and how to conserve water, that is much less expensive to undertake than it is to build lots of infrastructure. Reducing waste is relatively inexpensive compared to building infrastructure. And this is true for food as well, but also for water. Much of what we supply goes to waste. So reducing waste is a very important feature. And equity is extremely important and not that expensive to achieve. But once we achieve more equitable distribution of water, as with other resources, then the general level of social satisfaction, health, and well-being rise.
I'm interested, Dr. Mandari, because Arion mentioned about what was happening in Tirana with using apps for data. And Maitreyi, you're also talking about how much data is collected remotely actually since the pandemic. And I wonder if digital and data solutions can be used regularly to show improving health in healthy dry cities. I mean, are we just really starting to use data properly?
Thank you, Christy, for this important question. In fact, I may just share with you an example of the importance of data and information at this critical timing when it comes into, facing the challenge of shortage of water and lack of access to certain group of people. With this pandemic, in fact, colleagues here at the regional office, in collaboration with country offices and ministries of health, have been collecting information about what impact this Healthy Cities and Healthy Villages project have done when it comes into COVID-19 pandemic operations and management. And they found that, healthy cities and villages who implemented the 80 sort of standards in that program are better performing than other cities not enrolled into this initiative. And this to us, it sends a message that, whatever initiatives that are coming from within the communities, involving and engaging the communities, as Dr. Das had mentioned, definitely make a difference. And I totally agree with Arion when he says, that, whatever sort of expensive initiatives, equipments, machines we bring to the communities, unless we have a very positive attitude within our brains, we will not be able to utilize these sort of initiatives in a very effective manner. So the same thing is also applicable when it comes into teaching our students, our young generations, in schools, for example, how to make sure that whatever water we are having in the schools, at the same time asking them to keep clean hands and be safe from COVID-19 is really up to that sort of point to make efficient use of water and scarce water. So educational programs have been running in many of the countries in schools to bring them alternatives to water, in fact, especially in schools facing the difficulty. So I totally agree with you. Information and data is something key cornerstone for us to make sure that we are heading to the right direction.
And Your Excellency, I wonder if you've anything to add to that from Qatar's point of view about both the collection of data and also getting everybody on board, so that everybody understands the pressures of energy and water in Qatar.
I cannot agree anymore with my colleagues. The preservation or the conservation for the water and electricity, it should be a habit. This is the behavior change is necessarily, and I do see that all the new and young generation here at Qatar, they are becoming more awareness of the environmental sustainability. School programs are directed towards these kind of sustainability activities. And as I mentioned that we have realized in our energy conservation program, this is a national conservation program. It has targeted school kids, young generation, and all the inhabitants here in Qatar, and that's achieved 17% reduction on annual basis on the water utilization. We are also ensuring that the curriculums and the education, it includes a good part for the environmental sustainability, so that will become part of the education given to the kids. The reduction of the water utilization is a key to us, either at the consumption level, and also the recycle is very important, because it will also reduce the pressure on the supply side. As you probably know, that maybe most of our water is coming from the water desalination plant. So this fresh water is serving the 100% of our population. They have access to 100% of this fresh water. Also, we have an awareness park. It is a conservation center which it exhibit and demonstrate, and also give information to all its visitor about the importance of the water and how to preserve it. So this, as I said, that it goes with the education, it goes with the awareness, it goes even with the behavior, with the activity of the people. We have to keep in mind that this is very precious. Even in the building codes, the networks, dealing with leakages, maybe with dealing with abuse of the water, or maybe misuse of the water, so maybe through penalties or through whatever mechanism. So we are adapting and having a lot of laws where it is, and policies which is directing towards water preservation.
Now, can I just pause for a moment and thank the panel so far, but now welcome questions from wherever you are tuning in to Wish. just coming back to you and the kind of apocalyptic vision of this, which is, are we going to be facing in the world a retreat from certain cities that are just unsavable?
Well, all of the demographers tell us that this is a very complicated issue, but my view, Kirsty, is that we probably will. And water scarcity will be just one of the drivers. Another driver will be severe weather events, hurricanes that pummel cities again and again to the point that people who leave just don't want to come back. And a third is extreme heat. We have forecasts that make it pretty clear that in some parts of the world, some cities will become too hot for human habitation. Now, those three challenges, water scarcity, heat, and severe weather, can in some cases hit cities all at the same time. Rising sea levels are an addition.
I just want to ask you specifically about that actually the way that this may happen is not because people decide to retreat, but perhaps because insurers will not insure houses and buildings in dry cities, and actually it'll be the market that will drive people out.
It may actually, the lack of insurance may actually trigger out migration. You know, everything important we think about these, whether it's water or housing or transportation, we need to think about on a longer time frame than we've been accustomed to doing, because the world is changing fast. We already live in a different planet than our grandparents inhabited, and we can say with confidence that our grandchildren will live on a different planet than we do, although we can't recite all of the details at this point. What that means is that any vegetation we plant in a city has to be suitable to mature and thrive 50 years from now. Any infrastructure we put into a city has to be suitable for conditions that will prevail in 50 years. And on the question of migration, if we know that some cities are likely to have to decant their populations, in my country, in the US, that may be Miami or New Orleans or even Los Angeles, we need to think about where the receiving areas will be and create the surge capacity in those areas, enough housing, enough employment, enough transportation, so that there is room for the people who need somewhere to go. This is an extremely difficult issue politically. We've already seen politics in Europe and North America upended in recent years by a small stream of migrants relative to what we may expect in coming years.
Now, Ariane, just coming back to Tirana there, and you were talking about everybody buying in and therefore everybody becoming engaged in the water use and so forth. And I was just, what you were saying was very funny about, in France, nobody washes their Mercedes. I mean, obviously at certain times of the year in different countries you have, do not water your garden, but actually, are you actively thinking of certain things that cannot be done at certain times of year and actually prohibiting them? I mean, watering lawns, certain kinds of agriculture which are water intensive?
No, absolutely, you're correct. So what we do is we've expedited permits for people, for example, in rural areas, hassle-free to dig up a well. So what we do is we certify it with, zero red tape. By liberalizing, the market for digging up your own well for agricultural use, we've also killed the alibi when people say, well, look, I understand that people down the pipe need water, but I also, need to do my gardening and my sustenance farming. So, you can't do one without the other, because clearly people in rural areas where most of these water sources come from also have the right to dignified life. So there are ways to liberalize certain markets for people to use unfiltered, untreated, minimal cost water that they just pump off the ground. Second, we've really worked hard to reconfigure cities, because it's true for many countries that cities are identified as big blocks of concrete, only urban areas with very little rural conglomerations. What we did in 2015 is not only did we redivide the country in administrative areas, but we did a very healthy mix between urban and rural areas. So if you're the mayor of Tirana now, compared to 2015, it was 42 square kilometers of concrete, and now it's 1,200 square kilometers of concrete, but also of hills and mountains and forests and water sources. So then, bringing it under one management, you can mitigate certain restrictions in one area with certain liberties and projects on another area, so that you can. You're in charge of redistribution, not only of taxes and wealth, but also redistribution of water. Those who live closer to the source don't have bigger rights than those, further down the line in the city level. So sometimes the design of administrative systems is also key. And once you're the mayor of the downtown people, but also the mayor of the guy who lives, 32 miles from here by the water source, then it really makes your thinking a whole lot different. When you have to mitigate certain moves into the system with other sources for the people that get affected. But I think the most important is again, I'm glad Howard mentioned the issue of city forests, and I think urban forestry has become critical. For example, during our very hot months, not only do we stop our car washes and a lot of these other water-intensive industries, but also the use of the city water fountains and the use of the city hydration showers. And I think it's extremely important to work on the city canopy. Again, kids here become a valuable asset. We started playing this little game about 5 years ago, in which we invited parents to celebrate their kid's birthday by planting a tree, which will be there for the next 100 years, together with the child, hopefully. So then kids, not only metaphorically, but also physically put roots on the city. So it becomes their tree, and they take their friends for a walk to their tree. And in the hot months, they take a little bottle of water from their home to their tree. So they grow together with a part of the ecosystem, which is their personal, almost, birthday tree.
It seems that Albania is a kind of top dog at low cost plans.
Well, in many ways, you're basically crowdsourcing stuff the city can't afford. So we work with Italian architect Stefano Boeri, and he's famous in Milano for what they call the vertical forest. And we sort of said, look, and our friends from Qatar own most of those buildings in Milan. So we sort of said, look, well, we probably don't have the Qatari wealth to afford the vertical forest building, but what if we did an orbital forest concept in which we put a ring road? Now in a time where this was in the time when everybody was speaking about walls, right? And how to keep people away. So we said, but how about we make our walls different? Our walls are green, they're permeable, but they still signal limits to urbanization and to pouring concrete. So basically, we already have a GPS locator that tells you where the next available hole is for your birthday tree. And you work with our Parks and Recreation department. So they'll dig the hole for you and come and attend the actual plantation. But the whole family comes. This is a big event. They're planting their birthday tree. So it becomes a little celebration, but also you will accompany them for the rest of that family's life or roots in the city.
Matrai, we're just making it sound like dry cities are bad, which of course they're not per se bad, because apart from anything else, there's lots of good reasons to live in dry cities and diseases that don't spread or thrive in those conditions. So we must be careful not to denigrate dry-ish cities.
I think both extremes are bad. So it's dry, but how dry? Wet, but how wet? Cold, but how cold? And of course, we're not the master of the climate, or we could be if we used our resources carefully. We could be have a significant effect on the climate. But the reason we're talking about this here is because dryness comes with water insecurity, with water scarcity, with a certain kind of a burden of disease. And speaking of which, yes, some diseases may not be may be less transmissible during in dry contexts. But by the same token, water scarcity leads to a whole host of diseases, and when we talk about a double burden, you're basically at one end of the spectrum. You have communicable diseases, infectious diseases, waterborne diseases, vector-borne diseases. You have the infectious diseases on the one hand, but you also have the cardiovascular diseases, the non-communicative communicable diseases on the other. So you run the entire spectrum of being both almost like being in a rich place and a poor place at the same time. And so I'm not convinced that having dry cities that are too dry is necessarily a good thing. I think that they are manageable. That's the important thing that we take away from this collection, is that policy matters, that there's something you can do about this. You don't just have to leave people to fend for themselves. There's something you can do. Sorry, go ahead.
Yeah, Your Excellency, you were talking about desalination in Qatar, and that's obviously a key component of your ability to have fresh water in Qatar. But I wonder if you think there's low energy mass desalination technology available now, or is that actually quite an expensive thing to do still?
Yes, Christy. We are our desalination plant using a combined cycle techniques. It improves the efficiency for the gas efficiency from if it is from simple cycle, which is 30% to about 75%. So that's something which always we are adapting here in our new plants for the desalination. Also, we are open for any innovative solutions or technologies to conserve the energy when producing the water from the seawater. So as I told you that we are trying to always improve the efficiency of the energy utilization, and if there are new technologies, that we are open to adapt it.
It's funny. There was I'm just remembering now. 2 weeks ago, there was a big experiment. I can't actually remember what American city it was in, where they put off all the street lights. And so they didn't get the bleed out light to the sky, and they thought that was going to save an awful lot of energy. And it turned out it wasn't the street lights, it was the billboards, it was the neon, it was everything else that was in the city. And I wonder, when I think I've been in Qatar and you look out at the beautiful skyline and you see all that light at night, are you bringing that down?
Right, we have a policy that to change all these lights to energy efficient lights. So there is a regulation and it gives a period of time to the building owners and everybody to switch from the classical lights to the energy energy saver lights. It's worth mentioning that this initiative was able to save a lot of energy. Almost 18% of our energy has been saved. I mean, from the lighting itself. Not only that, but also we are using and the cooling for the buildings. We are using now for all the buildings we are using the district coolings, where these district coolings is more energy efficient, and it is we do like kind of what is called peak shaving. So we cool the water in the night, and it serves the buildings in the morning, and that's really it helps a lot on the energy conservation, and also it is saving a lot of energy to the buildings, about 20% saving for the like when you compare district cooling to the traditional cooling system which is used in the building.
And Dr. Mandari, circling back to the health of populations in dry cities, what are the biggest disease concerns on the horizon for these populations specifically? We heard a bit there from Howard before.
Yeah, in fact, if we talk about a wide spectrum of diseases that may face people living in healthy dry cities, they are, as Dr. Das mentioned, it ranges from communicable to non-communicable diseases. Yeah. Communicable diseases, it is well known, like things like, for example, vector-borne diseases like malaria, dengue fever, and other diseases. But when we talk about the most common trend nowadays, affecting mainly, if I may call it, wealthy nations or modern sort of type of diseases, diabetes, hypertension, ischemic heart diseases. But the sort of trend of disease that we are worried about, which affects all age groups, is the mental stress or mental health diseases. And if we have this sort of lack of water or lack of access to water or clean water, added to the stress that is coming due to hard living of certain group of people, mental stress is definitely there. And in fact, when we talk about about the two main challenges that are facing people when it comes into water, one of them is access to safe water and clean sanitary systems, as well as water related problems due to disasters like floods or droughts. And many countries are facing that sort of challenge. Now, when it comes into the second type, and also for the first, the first type of challenge, because of a lack of a sanitary system, waterborne diseases like diarrhea, for example, is one of the common challenges that also facing many countries. So these are the type of the diseases that we
mental health. It's interesting that you say mental health, but now we're just about to bring this to a close. But if I could just have about 30 seconds from each of you on your rallying cry from this conference about what you would do to make healthy dry cities, what would it be? Starting with you, Howard.
I'd say three things, Kirsty. Number one, never solve just one problem at a time. Things are so complex and interrelated that when we solve the problem of dryness, we should also be tackling the problem of health and the problem of transportation and the problem of food and so on. Joint problems. Number two, never solve problems just in the present tense, but think ahead 50 to 100 years in a world that we know is rapidly changing and solve problems in ways that will be robust for a long time to come. And number three, never solve problems only for some of the population. Think about who is most victimized, most unfortunate, most deprived, and solve problems for them. Everybody will benefit.
Thank you very much. Your Excellency, a rallying cry for people?
Hello?
Hello, yes.
Yeah. I believe the key to the main issue here is that we should there are a lot of opportunities in reducing the waste, water waste or solid waste. There are a lot of opportunities in converting to renewable energy. We should always aim to enhance the livability of the cities, improve the quality of the life, and putting this as at the center heart of the planning and urban planning of the city on all aspects, on the design and the operation and the maintenance and all aspects of activities which we are doing. We should always aim to increase the livability and the quality of the life and on the city. That's the main thing which I want to say.
Thank you very much indeed. Maitre.
At the risk of repeating myself, I will say invest in data and analysis and use it for policy making, make it available for others to use, and encourage evidence. So that would be one block. A second block is something we haven't spoken about, but I do want to leave the audience with that thought, is we haven't spoken about financing. And that's something in terms of what do we do with innovative financing, because we do live in a resource-constrained environment, and so we cannot have everything we want. So
thank you very much.
Prioritizing and financing.
Dr. Mandari.
Thank you, Kirsty. Thank you. In fact, based on the discussion we have had, it is really very stimulating and very enriching. I may say that, three key messages. Health is not the responsibility of Ministry of Health. It is the responsibility of every one of us, either individuals, communities, government, and non-government organizations. And we have a very good example in this discussion. That's why, in fact, we came out here in Emro 2 years back with a new vision for the Eastern Mediterranean, which is, we call it Health for All by All. It is a call for solidarity and action. A child in a school is, as Irion mentioned, may have a very major impact in his parents to direct them towards safe use of water or efficient use of water. So health for all, by all, health is not a responsibility of the Minister of Health, it is a responsibility of everyone. And that's why, in fact, we introduced the concept some time ago in WHO, which is called health in all policies. Whatever policies produced by countries, either for transport, for water, sanitation, education, everything, health should be at the heart of all of these policies in order to have very healthy citizens in every location in each country.
Thank you very much indeed. And Erian Veliaj, we'll leave you with the final word. What is your rallying cry for people based on your own experience?
Well, my rallying cry would be resilience. We need resilient cities. And the reason why I say this is not from the books, it's from my own experience. I remember my first year, we had this major drought, and people were trying to calm a new mayor by saying, well, Mr. Mayor, don't worry about it because this only happens once in 100 years. Then the second year, we had massive floods. And again, the specialists, the experts were saying, well, don't worry about it. Once we go through this, it only happens once in 100 years. And my third year, it snowed in the middle of the Mediterranean. It hadn't snowed since I was a kid, late 70s, early 80s. And people said, well, don't worry, because snow like this in Tirana, we don't need snowplows because it only happens once in 100 years. Last year was 2019. We had 2 consecutive earthquakes, and we're still recovering from 2 major earthquakes in September and November. And people literally, and they were right, they said, well, Mr. Mayor, once we go through this nightmare, which only happens once in 100 years, we're going to be fine. And this year, as everybody knows, we had the pandemic, which literally only happens once in 100 years. So my rallying cry, prepare for every year like it only happens once in 100 years, because it does. And we are now living in a moment where we need resilient cities to really prepare that every moment is once in a century moment.
Well, with that, I'd like to thank you all very much indeed for taking part, and to those of you, wherever you are in the world, for listening this afternoon. Thank you very much indeed. Goodbye.